Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hello again, Dr. Moya.
Hello again, Brittany.
So, I want to talk to you about a common question that we get asked, I believe, is how do you deal with helping your patients who end up with a potential healing issue after surgery, who are traveled from out of town, further away, can't come to the office frequently?
Another great topic to talk about. Obviously, since we see quite a few patients that are from out of town when it comes to our skin removal practice after weight loss, I always tell my patients that they're never alone. Number one, I mean, I'm their patient. I mean, they're my patient for life. Mm-hmm. I mean, I'm their physician for life. Acutely after surgery, they know that they can always reach me. If it's after hours, it's going to be through my business cell phone number,
mm-hmm.
and that's how they get a hold of me. If there's an issue that arises, I'm always available to talk them through how to take care of something. If it's some small wound, spitting stitches, a little fat necrosis that develops into a small wound, I'll counsel them on how to take care of that, washing it every day, or maybe some ointment, or maybe putting a dry dressing on it, or maybe they have to do a little bit of packing. Mm-hmm. I'll kind of walk them through it step by step, or somebody who's helping take care of them. If it gets to a point where a patient is just not comfortable with that, or a patient would prefer that they're being seen in person mm-hmm. by a medical professional, then I'm always available to talk to their doctors. And I've done that, meaning, do they want to see their primary care physician just to take a look at what's going on at the surgical site? Mm-hmm. And then I talk to the primary care physician, kind of give them an idea of, what we've been doing and what I'm seeing and what my recommendations are. If a patient gets referred out to a general surgeon or a plastic surgeon, meaning a surgeon in general, to take a look at the mm-hmm. wound itself, I talk to them as well. And everybody's pretty good about working together because, right. I'm obviously the operating surgeon and I know what I did there. So mm-hmm. it's really good to give these other providers who are helping with my patient's care information from my perspective of what I've done and
right.
What I would recommend.
Right.
So I've done that, and I think that helps patients feel more comfortable traveling from out of town mm-hmm. to undergo, a big surgical procedure such as a Corset Body Lift.
Right.
The great thing about, the way we do things, thank goodness that those kind of issues are on the low end. Right. Really, at mm-hmm. the end of the day, when you take in consideration all the patients that we help. But it's something that we do have to discuss because it is a big part of the decision-making process for a patient to decide, do I come to Lewisburg Plastic Surgery to be seen by Dr. Moya, get treated with a Corset Body Lift, or do I just stay locally and right. and maybe do another procedure that could still make you happy? Mm-hmm. Maybe not, obviously, Corset Body Lift waistline, but but could still make you happy and not have to deal with, what happens if something comes up. Mm-hmm. But we've been doing this long enough that we found that that works very, very well. Mm-hmm. And like I said, I'm always available. Sometimes I get called in the middle of the night. Mm-hmm. It is what it is, right? Right. And I try to help patients so they don't feel uncomfortable mm-hmm. or afraid
right.
or something that they don't need
right.
to be afraid about.
Right, exactly. I know that is a big concern, and they get just scared, like they're going to fall apart, and they just
Absolutely.
Need reassurance and need to make sure that everything's going to be okay.
Absolutely. So, and that's what we do. And like I said, once I accept a patient and I operate on them, then I am with them the whole way through until they're completely healed. And of course, always available even after that.
Mm-hmm. Okay, perfect. Well, that's all I wanted to know about that topic. Thank you very much.
Well, thank you. I think that was a great one.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.